Tom Price's resignation as Health and Human Services Secretary Friday ended an inglorious and brief tenure. Though his arrogant waste of taxpayer money on chartered plane trips brought him down, his more serious failure was in policy, and belongs to the entire Trump administration. Shortly before Mr. Price resigned, President Trump raised the possibility of striking a deal with Democrats to fix the healthcare system. Mr. Price, a hard-charging partisan Republican, would no doubt have been a roadblock. Mr. Trump should find someone less motivated by ideology, shift gears and work to actually improve health care for all Americans. Mr. Price was a leading voice for pulling apart Obamacare using partisan tactics in Congress and sabotage in the executive branch. Instead of encouraging people to sign up for coverage, Mr. Price used public money to pummel Obamacare, often blaming the law for problems the Trump administration itself created or exacerbated. His relentlessly negative message frequently drifted into nonsense. He insisted that Republicans were not cutting Medicaid, the healthcare program for the poor and near poor, when the House had just passed a bill containing a massive Medicaid cut. He claimed that the GOP's American Health Care Act would result in more people getting better coverage, when the Congressional Budget Office found that 24 million more would go uninsured, a report Mr. Price called not believable even as he admitted he had not read it. He insisted that Obamacare's requirement that all Americans obtain health coverage raised health care costs, when the opposite is true.